on to the level of the HHS, which is the Health and Human Services Division of the Cabinet and the government, that provides regulations on how healthcare is provided. And one of the biggest regulations that's under attack right now is conscience protections for healthcare workers. In that if a physician, doctor, other healthcare worker has a moral objection to performing certain procedures such as abortion, euthanasia, gender reassignment surgery, that they cannot allow their either religious beliefs or deeply held conscience beliefs to interfere with that service being provided. The fault in this is that there is no medical decision that does not have a conscious basis, because conscience is formed by many different things. It's formed by our experience, our religious experience, by education, by the scientific data that is available to us, and even atheists can come to what we consider to be a moral decision of what's right and wrong.
This is Dr. Michael Parker, who's president of the Catholic Medical Association. Go ahead, Dr. Parker.
All right, thank you. It's a rather busy slide. I don't know if going through it will start anything, so I'm just going to get started here. I'm Dr. Michael Parker. I'm the current president of the Catholic Medical Association. And the Catholic Medical Association, if you don't know who we are, is one of the largest organizations, a physician-led organization of Catholic healthcare professionals in the United States, with about 2,700 members currently, and hoping that our numbers grow exponentially as we face the current crises that we see in the United States and around the world. Our mission statement is to form and support current and future physicians to live and promote the principles of our faith and the science and practice of medicine. And our vision is to inspire physicians to imitate the divine healer, Jesus Christ. When I was asked to give a talk about this, I was asked to talk about the obstacles to the practice of Hippocratic medicine. And my first thought about this was, okay, that's pretty easy talk to give. My problem was, how do I limit it? And I am a victim of burnout, and it's why I do what I do in my career right now. But one of my biggest things that I like to study is the efficiency of and management of humans, and how we can start performing on higher levels. And I just got done reading an article by Greg McKeown, who's written books called Effortless, and also he says that when he does presentation, he only has 6 slides and 10 words. So I thought, well, I can beat that. I'm going to use 2 slides and talk about this. I think we have to go back to what the basis of medicine is all about. Medicine is about altruistic relationships seeking to alleviate disease and suffering. And for Christians, this was based on the example that we have of the divine healer and the divine physician in Jesus Christ, who heals us in mind, body, and spirit. The Hippocratic Oath, while it came out well before the time of Jesus Christ, was one of the first documents that defined the relationship between physicians and their patients in an ethical way. It was a solemn oath that expressed solidarity between the teachers of medicine and their colleagues. It promoted the ideals of beneficence and non-malfeasance, which is do good and do no harm, not to assist in suicide or abortion, although there are people who will debate that we leave the surgery to surgeons, thank you, and not to seduce our patients, and maintain confidentiality. This was in place and was a guiding principle for well over 2,000 years for medicine. And this was replaced eventually by the principles of bioethics, which teaches autonomy for the patients mainly, but must be remembered that there is autonomy for the physicians also. These principles also express the dignity of the individual, as well as the attempt to do good and do no harm, but also defines a term that is rather vague called justice. And what that means is to basically provide equitable health care to all people. But it can be determined in many different ways. In the Catholic tradition, we have the Catholic principles of social teaching, that we are human and imperfect, that medicine in the past was not always fair or of high quality. It may have been discriminatory and financially not available for all, but that Catholic and religious hospitals and healthcare systems actually came out of this to address these issues based on the principles of, one, the dignity of the human person, that we're all in the image and likeness of God, and we possess that dignity merely because we were created, and not just an object, as we've been hearing a lot of people talk about becoming the objects of sexual perversion or objects of some type of social agenda. We're capable of self-knowledge, of self-possession, and of freely giving ourselves and entering into communion with other persons. That's the basis for informed consent. That we believe that problems are best served at the local level with a higher level of cooperation, and we do that in solidarity with those we serve to achieve the common good. And that government and legislative health care really should not be a big part of that. So what are the attacks that we see on health care? Well, if we look at it, we can look at it from a government level and also a judicial level. With regards to the government, there is a current trend to take over more and more of a centralized approach to health care, which violates the principles of subsidiarity, but in many ways also violates the principles of the dignity of the human person. We see this with abortion and euthanasia, and also with the sexual orientation, gender identity. How has the government done this? They've taken over healthcare with the Affordable Care Act that was passed in the Obama administration. Initially, it started with Medicare and Medicaid. Before the Affordable Care Act, we had Medicare and Medicaid to care for those who were unable to insure themselves, and also for the elderly. With those, the government took the ability to say to physicians and to healthcare organizations what they must or must not provide to these, and started to have that coercive nature. Now it's gone to the level of the HHS, which is the Health and Human Services Division of the Cabinet and the government, that provides regulations on how healthcare is provided. And one of the biggest regulations that's under attack right now is conscience protections for healthcare workers. In that if a physician, doctor, other healthcare worker has a moral objection to performing certain procedures such as abortion, euthanasia, gender reassignment surgery, that they cannot allow their either religious beliefs or deeply held conscience beliefs to interfere with that service being provided. The fault in this is that there is no medical decision that does not have a conscious basis, because conscience is formed by many different things. It's formed by our experience, our religious experience, by education, by the scientific data that is available to us, and even atheists can come to what we consider to be a moral decision of what's right and wrong. HHS has also put out regulations regarding and changing, when we talk about changing the terminology of medicine, they talk about essential health care. Or the right to preventative health care, and within preventative health care is considered contraception and abortion services. They determine what is basically essential health care. The difficulty with this is that as we see right now, we're at the mercy of political parties in control and in special interest groups and corporations, Planned Parenthood, insurance and big pharma, but also within our area, the Catholic Hospital Association. With legislation not coming from the administrative level or the executive level, we're going to see something happen here in this country that we haven't seen in probably 40 years. We're going to see an appropriations bill passed without the Hyde Amendment. And it's going to pass the House. Our only hope is to try and stop it in the Senate. And if you're from the states of West Virginia or Arizona, I would strongly encourage you to petition your senator if they want to pass the appropriations bill to make sure that the Hyde Amendment is included. Eventually, we in Ohio, we just passed conscience protections for our healthcare workers and our ability not to be sued if we do not perform these procedures. But eventually, they're going to come after our licensure. Right now, licensure is done at a state level, but with increasing government control of healthcare with the Affordable Care Act and the call for universal healthcare, they will eventually go to a universal licensure system. And if that goes into place, doctors of religious faith or doctors with moral beliefs that are contrary to what the government is going to be mandating will not be provided with licensure. What we also see outside of the government is the corporatization of medicine and the influence of the governing bodies of medicine. With corporate medicine, we're seeing a decline of solo groups or privately owned practices. And with that decline in solo or group or individually owned practices, medicine is a business now. Medicine is actually an art that's trying to be run like a business. Interactions with our patients are now transactional versus relational. And they're no longer relationships that are built on mutual trust and compassion. This is not only affecting the quality of care that's being provided by our patients, but it's leading to burnout among physicians because they didn't go into medicine to have a 15-minute transaction where I provide you with whatever you want. I'm not your barista, I'm your physician. Okay. Insurance carriers are getting involved, but we're also seeing in governing bodies, the American Medical Association was just mentioned. The Catholic Medical Association 2 years ago was very instrumental in preventing the AMA from changing their stance on physician-assisted suicide from against to neutral by bringing in a large number of medical students. They seem to listen to them to oppose this. The American College of Obstetrics and Gynecology has even expressed in some of their literature that if you do not have an abortionist in your area, that you are required to perform an abortion for that woman despite your moral objections or beliefs. And these groups have accepted the woke policies where evil is now good and good is now evil. And we'll see that we're seeing this with SOGI. The AMA has put in a 3-year plan to institute critical race theory into their organization. And we see this with abortion and end-of-life issues. But not only that, we see it within our education systems and with the social network and media that we see. The education systems are discouraging people of faith and people who are pro-life or have alternative views to the current societal norms to not enter into the medical professions. They're doing that through a silent, subtle discrimination through the interview process at medical schools and discouraging people of faith or of pro-life causes not to go into certain subspecialties such as obstetrics and gynecology and family medicine. They are really pushing these agendas through the residency programs and the graduate medical education programs. From the individuals themselves, we're seeing more and more moral relativism with a distorted anthropology, this right to health care. We don't have a right to health care. We have a right to seek health care from a licensed professional who's willing to work with us on our needs. They're not getting ethics training within their medical school, and the Hippocratic Oath has been replaced by whatever the class of that year decides that they want to say with regards to medicine. And it's really abandoned the, not so much the do no harm and the abstinence from abortion, but it's gone to accept the legal standards of what's present at the time. And this is why abortion was removed, because it became legal within the country. And at the time I took my Hippocratic Oath, it said, I will not provide services that are illegal, or that I will provide all legal services to the patients. So we mentioned this, the soft discrimination, the hard discrimination. This comes from their peers, okay? Students for medical students for life are often ridiculed by members in their own class. They're not given times to have meetings, and they also are denied elective rotations that they put together within their medical schools. They also, the financial impact that we see on medical students with the increased cost, the average I think is around $300,000 to achieve an undergraduate in medical education. They are being forced to go along with some of these things because they cannot accept the financial impact that being thrown out of medicine would cause. The good news is we are restoring this. I use the acronym of the CMA. By collaborating with like-minded organizations, such as the 2 organizations that are represented with me here on this panel, we have to mobilize. We have to do things like this meeting to get grassroots support of members, but also our patients. If there are 30,000 doctors, that means there's 300,000 patients that we can mobilize for our cause. And we have to attack the corporate, and we have to look for corporate support of the cause. And then finally, we have to take action. We have to develop alternative care delivery systems outside of the current constraints. This may be direct primary care or some other ways. We have to provide for alternative education and certification, and we have to take legislative action. We can't be silent anymore and think that we as doctors shouldn't put ourselves on a pedestal. We will be gone if we don't take legislative action. We have to assume leadership within medical societies, and eventually it's going to come down to civil disobedience to unjust laws. Thank you.